I'm Vicki Whittemore, a program director at NINDS at the National Institutes of Health and co-chair of the Epilepsy Benchmarks Stewards Committee.
Hello, I'm Ann Puduri. I'm a clinician researcher at Harvard Medical School and Boston Children's Hospital, where I direct the Epilepsy Genetics Program.
I am Eric Marsh, Associate Professor of Neurology and Pediatrics at the Pullman School of Medicine at the University of Pennsylvania and an attending pediatric neurologist in the Division of Neurology at the Children's Hospital of Philadelphia.
And I want to thank all of our benchmark area leads, stewards, and the Epilepsy Leadership Council for their thoughtful discussions and incredible efforts to put together the revised epilepsy benchmarks.
The first epilepsy benchmarks were established by the epilepsy research community following the Curing the Epilepsies conference in 2000. Investigators often cite the epilepsy benchmarks in their grant applications, and the epilepsy community uses the benchmarks as a way to track support towards different research areas, serving as a framework of the essential research needed for epilepsy.
We've been busy with our committee over the last several years, and our area leads and stewards have been hard at work reviewing the literature, discussing thoughtfully, and soliciting input from a variety of sources.
The benchmarks have been updated every 7 years in conjunction with a Curing the Epilepsies conference. Due to the COVID-19 pandemic, the in-person conference planned for April 2020 has been replaced with a virtual meeting that will take place on January 4th through 6th, 2021.
We, the Benchmarks Committee, look forward to your suggestions for the 2020 Epilepsy Research Benchmarks. These benchmarks will lay out all the major areas of epilepsy research over the next 5 to 7 years.
We're here now launching a campaign. This is going to be a two-part campaign, starting with the first one to look for your input on the revisions to the benchmarks. What's missing in these revised benchmark areas? Are we missing some large areas? Are we missing some subtleties? What could be nuanced better? The more we hear from you, the more that these can be representative epilepsy research benchmarks.
We are particularly excited about discussing new priority areas, including moonshot ideas that can transform the state of our understanding of the treatment of epilepsy.
We will launch a second campaign in a couple of weeks to discuss transformative research priorities that would significantly move the epilepsy field forward.
These are going to be research priorities and research topics that, if pursued deeply and collaboratively, we hope will transform how we think about epilepsy from a research perspective and in a way that will translate to the care of people with epilepsy.
Please provide your ideas and feedback, and watch for Campaign 2 in a few weeks with a focus on identifying these truly transformative research priorities that could change the lives of individuals living with epilepsy, their families, and caregivers.
So please join us in these two campaigns and look forward to January 2021, when all of these efforts will culminate in a virtual conference.
Thank you on behalf of the entire committee. We look forward to reading your excellent suggestions. Now start submitting those ideas.